Hi, my name's Jo and this is my dog Meg. She absolutely loves coming to Highcroft Vets. She literally picks up the pace when we get nearby and drags me through the main gate, but she knows she's going to get a really friendly welcome and a schmacker or two.
Highcroft is quite a large practice. We've got 12 sites, 12 clinics, as well as the hospital here at Whitchurch, where we have the referral practice.
We are here 24/7, so there is a vet and a nurse on site all the time, and we're here to look after your pets. So on a day-to-day basis, I tend to see cats and dogs mostly. They're certainly the most common pets that people have. But I work in a practice where people will see anything from tortoises to
budgies and cockatiels.
Fish to birds of prey to
raccoons, meerkats.
The bat cesarean.
Things like blue-tongued skinks, for example, and bearded dragons.
Rabbits to ferrets.
But yeah, regardless of the species, whatever it is, they get absolutely the same care and treated like our own animals, really. We do quite a lot of weird and wonderful operations. We had a fish that had to have a tumour removed from his face and ultimately ended up having his eye removed.
The exotic vet team, fairly prolific in their unusual cases. They've managed to help a tortoise who had a very bad leg injury by putting him on wheels, which sounds unusual, but the tortoise is doing very well. And recently they gave a blood transfusion to a rabbit, which is a pretty big deal. It was a life-saving procedure, but again, very unusual.
Working at Highcroft, I'm really lucky because I've got access to loads of fantastic facilities, not only things like a CT scanner, we've got ultrasound machine, endoscopy.
We have quite a lot of equipment that isn't in your normal vets. So we have a very high level ultrasound scanner, the sort of thing that's used to scan hearts in children at Great Ormond Street. We have an incubator for paediatric patients or for smaller patients. Well, we have a large team of specialists now. I'm a cardiologist. We have got specialists in surgery, specialists in internal medicine. We work with a referral dermatologist. We have specialists in ophthalmology who visit and work with us, as well as ophthalmology eye vets who work in-house. And also we have a specialist in emergency and critical care. And we also have a dedicated anaesthetist for safely anaesthetising very sick patients.
The most common question that I get asked as a veterinary surgeon, and that hasn't changed from being a new graduate to being 11 years qualified, is what would you do if this was yours?
Every day you do get really close to them, and you do learn the animals' own sort of personality and what they like, what they don't like, what kind of walks they like to go on, and you know the owners as well, and get a really good bond. Yeah.
It's a brilliant job, we all love it, we're happy doing it, every one of us. It's an incredible place to be. And to see what actually goes on behind the scenes is amazing. We've got some very, very good brains here and very good talented people, you know.
It would be nice for owners to know how much you sort of fall in love with their patients, because I know it is just a patient, but to us you you can fall in love with them within a couple of hours of having certain surgeries done, and then you just have to wave them out the door. Then it's like, actually I love that dog.